Mitochondria are often called the powerhouses of our cells. They are tiny structures that produce energy for our bodies to function. This energy comes in the form of ATP, which fuels everything from our muscles to our brains. Mitochondrial diseases occur when these cellular powerhouses malfunction. This malfunction can lead to a wide range of health problems. The severity of these problems varies depending on the type of mitochondrial disease and which tissues are affected. These diseases can affect people of all ages. They often manifest as problems with organs that require a lot of energy, such as the brain, heart, and muscles. Symptoms can include muscle weakness, fatigue, vision and hearing problems, learning disabilities, and even organ failure. Understanding mitochondrial diseases is crucial because they are a significant cause of genetic disorders. Early diagnosis and management are essential for improving the quality of life for individuals living with these complex conditions. Mitochondrial diseases arise from mutations in our genes. These mutations can affect either the mitochondria's own DNA, mtDNA, or the DNA found in the cell nucleus, nDNA. Both types of DNA carry the instructions for making proteins essential for mitochondrial function. Mutations in mtDNA are particularly significant because they are often inherited maternally. This means that a mother with an mtDNA mutation can pass it on to all her children. However, the severity of the disease can vary greatly among siblings. This variability in severity is due to a phenomenon called heteroplasmy. Heteroplasmy refers to the presence of both normal and mutated mtDNA within a cell. The ratio of mutated to normal mtDNA can determine the severity of the disease. Understanding the interplay between mtDNA and nDNA mutations, as well as the concept of heteroplasmy, is crucial for comprehending the complexities of mitochondrial disease inheritance and manifestation. There are many different types of mitochondrial diseases, each with its own set of symptoms and severity. Some of the most common mitochondrial diseases include MELAS, MRF, and Kearns-Sayre syndrome. MELAS, which stands for mitochondrial encephalomyopathy, lactic acidosis, and stroke-like episodes, typically begins in childhood. It is characterized by muscle weakness, seizures, stroke-like episodes, and dementia. MRF, or myoclonic epilepsy with ragged red fibers, is characterized by muscle jerks, epilepsy, and weakness. It often presents in childhood or adolescence. Kearns-Sayre syndrome is a rare mitochondrial disease that typically begins before the age of 20. It is characterized by progressive external ophthalmoplegia, weakness of the eye muscles, pigmentary retinopathy, degeneration of the retina, and other neurological and cardiac problems. These are just a few examples of the many mitochondrial diseases that can affect individuals. Understanding the specific symptoms and progression of each disease is crucial for proper diagnosis and management. Section 4. Unmasking the culprit. Diagnosing mitochondrial diseases. Diagnosing mitochondrial diseases can be challenging due to the wide range of symptoms and their overlap with other conditions. It often requires a multidisciplinary approach involving clinical evaluation, family history, and various laboratory tests. Clinical evaluation involves a thorough assessment of the patient's symptoms, medical history, and family history. This information helps clinicians narrow down the possible diagnoses. Muscle biopsy is often a crucial step in diagnosing mitochondrial diseases. It involves taking a small sample of muscle tissue and examining it under a microscope for abnormalities in the mitochondria. Genetic testing is another important tool for diagnosing mitochondrial diseases. It helps identify mutations in mitochondrial DNA or nuclear DNA that could be causing the disease. Biochemical tests can also be helpful in diagnosing mitochondrial diseases. These tests measure the levels of various substances in the blood or urine that can indicate mitochondrial dysfunction. Section 5. Managing the symptoms, treatment, and care strategies. While there is currently no cure for mitochondrial diseases, various treatment options are available to manage the symptoms and improve the quality of life for individuals living with these conditions. Supplements and vitamins are often prescribed to support mitochondrial function. These may include coenzyme Q10, creatine, and various B vitamins. Medications can be used to address specific symptoms such as seizures, muscle weakness, and heart problems. The choice of medication depends on the individual's specific needs and the type of mitochondrial disease. Lifestyle changes, such as regular exercise and a balanced diet, can also play a role in managing symptoms and improving overall health. In addition to these treatments, supportive care is essential for individuals with mitochondrial diseases. This may include physical therapy, occupational therapy, speech therapy, and psychological support.